a good plan to you guys?
I'm not sure if we're supposed to be hearing anything, but I'm not hearing anything on this end over here.
Did you get that, Mar? And say your name and your agency.
Jerry, step up.
Okay, Jerry with Step Up gave the motion. Do I have a second? Can you stand up and say? Okay, we need from a different agency. Can I have another person? Second, please. Can you say your name and agency? Okay, and do I have any abstentions or objections? Hearing none, the item passes. I could get my holiday exercise by doing this meeting. What do you guys think? I kind of like this. Okay. All right. The next agenda item is public comments. So at this time, members of the public may address the Continuum of Care members for items that are not on the agenda. Marielle, have we received any written public comments for the record? No, we have not. Is there anybody here in the room or online that has a public comment? And I'll rely on the HWS team up there to tell me if we have anybody.
I can't get out of this.
No? Was that a yes? Anybody here that has a public comment while we're confirming? Was that no? No, okay. Hello, welcome. It's the amazing Leonard from Path of Life. Come on down, Leonard. Okay. The next agenda item that we have, yes, all of the people, and I think Sunday, I don't know if Sunday got hers from Supervisor Washington's office, but she came in. So the next item that we have, I'm super excited. Those of you know this is one of my favorite times of the month because we want to be able to celebrate leadership across this county. So many amazing things are happening. And our wonderful Continuum of Care is a vibrant public-private partnership. Sometimes we have our nonprofits that are giving us an update. Sometimes we have our wonderful county agencies and other public agencies. I'm super excited that we have Renee Huxted from DPSS. I have to tell you that this lady has saved me so many times. We've partnered for so many different families for the HSP program, where we're trying to leverage our limited resources for people that are in need of shelter. And just as an example, our motel shelter program here in Corona has like 100 households deep waiting list. So we try to work together, and I know that there's probably many of you in this room and online that could give us tons of examples of how Renee has saved all of our bacons, right? Where she's come in and helped us with those precious resources. And I think it's important to note too the leadership of Heidi and the HWS team, because there's a contract that HWS funds, correct, Emma? To support DPSS and also APS. So our Continuum of Care funds go in. So without further ado, I want to pass it over to Renee. She's going to give us a presentation on her programs. Renee?
Hi, thank you so much. I have to say ditto to all the partnerships across the county. I have reached out to many of you with services I need and to connect and braid funding. So I appreciate everybody for their assistance with me. And if I can be of any help, please always reach out to me, because I'm just an email or phone call away. So with that, I'll share a little bit more about the housing support program. First off, obviously I'm from the DPSS self-sufficiency unit over here at the county. I'm the administrative services supervisor for the housing support program, as well as a couple other programs that we have out there for our families who are in need on CalWorks. And I am so excited to share that we have just received notice from the state that we've got additional funding of about 3.6 million to use until fiscal year 24-25. And that's in addition to the monies that we've received over the past couple of years. So I'm going to share how much we've received over the years, but I definitely wanted to bring that update to all of our partners, let them know that we're still getting funding from the state. And it's much needed. I know we've seen an increase of people coming into all of our programs with the rising costs of rents. It's definitely been an influx, so much needed, and I'm excited to share and partner with everybody and braid our funding as we go along through the year. So go ahead and go to the next slide. And I apologize, I'm not there in person. I was planning to be in there, but I'm a little bit under the weather, so don't want to spread any germs. But that's why I'm not there. I did RSVP though, so somebody got my sandwich. But anyhow, just a little bit of history on the housing support program. It was passed by a Senate bill way back in the day. If you can kind of click forward, and we received it's to foster housing stability for families in the CalWorks program. Keyword CalWorks. I know I get a lot of questions about families who do not have CalWorks. That is one of the main criteria for our families. They have to have CalWorks. Now, if they don't have CalWorks, I will definitely be able to assist them in getting, or our team will be able to assist them in getting connected. I put a couple of links down there at the bottom of the slideshow, but one of its benefits, if they do not have CalWorks at all, that's the place to go that they can apply online. Really simple, really easy process that they can do. It asks for their general information, and it gets a referral sent to our county, and then a worker will reach out to them. That way they can get their foot in the program. CalWorks has that Cash 8 benefit. They get that monthly cash allowance, as well as money for food stamps and that medical aspect for Medi-Cal. So all three of those linked in for those families. And of course, for our homeless families, if they're homeless and they have a parent eligibility to CalWorks, once they come into our office or apply online, then they will issue the CalWorks temporary homeless assistance, and that's that 16 days of temporary shelter before they refer them directly to the housing support program. So I'll explain a little bit more about that, but just want to let you know that CalWorks is one of our main eligibility criteria. So it came down, it's a rapid rehousing program. And of course, we partner with the Continuum of Care. We're a member, and we are always there for you guys if needed. But that is one of our mandates too. We have to be part of the Continuum of Care, which is a great mandate to have because it opens the doors to so many partnerships that we didn't know were out there for our customers. So this is always ongoing program, but of course it's always up to the state budget and the governor's budget. So we keep an eye on that every year to make sure that we're getting some funding down the road and anticipate that. Next slide, please. So I just wanted to show our funding through the years. We are a program that, man, it's already going to be 10 years. It's kind of crazy. We started mid 2014, and 15-16 was really the year we kind of kicked off. But I started with 16-17. Tanya was back in the day with us when the program first started, and we first collaborated with the Housing Authority when our program got going. But you can see our funding has increased over the years. We started at 1.8, 1.9, and then in 21-22, we got a huge spike, about $10 million. That was non-competitive funding that we received from the state, and it was really special because it was to roll over multiple fiscal years. Prior years, it was one fiscal year, lose it or use it. or use it or lose it. And then it went back into the pot. So with this one, we're able to kind of use the money more fluidly and be able to prepare for next fiscal years. So 21-22, we got that 10.6 million in addition to any monies that we hadn't spent in 2021, which is the pandemic years, really. So we got that. And then in 22-23, we got additional 10.1 million. So those are rolling over multiple fiscal years. And then in 23-24, we got the 3.6. It looks like it went down, but these chunks of funding are really available over 3 fiscal years, and they kind of overlap, which you'll see in the next slide. If you go over, kind of show a visual representation of how the funding overlaps over the years. So that 10.6 million, if you click, it goes through 23-24. That one, I have to say, the state was asking us if we're gonna be able to spend it by the end of this fiscal year. Yeah, we spent that money. It's gone. We had it done by the first quarter of this fiscal year, pretty much. So we're now in the second pot of money, the 10.1 million plus the 3.6 million, which is rolled over through 24-25. So we have essentially 2 years to spend that money, which we're obviously going to be able to spend with the projected costs of everything, which includes staffing, temporary shelter, eviction prevention. I'll go over a little bit more of our services in just a second. So if you go to the next slide. And if you have any questions at any time, please feel free to ask. I know I'm the type of person, how do I, oh, I don't know if that's for me, a member. But that if I have a question in mind and I kind of forget it, so I tend to like to ask it right away. I also wanted to show you how many families we've housed over the years, right? We've assisted so many families, but these are the families we've actually housed throughout the years. We had a little downtick in 2021, 2022. Obviously, it was COVID years, so we had those eviction moratoriums and stay-at-home orders, but we were still able to house 155 families and 179 families in those years. And then last year, I think we obviously hit our biggest mark of 350 families. Our goal this year is 377 families, and we're already at 135 families this year. So we are actively working and partnering with landlords out there in the community to house our families and rapidly, as quickly as we can, through our program. But if you add all those numbers up, if you click on the next button, we've housed over 2,000 families. So it's amazing how many families that have come through our program and we've supported over the years. So yeah, that's super exciting. We're like one of the top in the state, not to brag or anything, but we are a big and mighty county, and we've done an amazing job. So next slide. So a little bit more about what the housing support program, who's eligible. I kind of went over that. CalWorks families who are literally homeless. Those are our families who are unfortunately have lost their housing or on the streets, on a park bench, in a shelter. They are obviously eligible for our program. In addition, we also have the families who are at imminent risk of homelessness, meaning they're about to lose their housing within the next 14 days, and they have no place to go. So we are looking at those families. And the next population, if you click to the next slide, that was added in the most recent fiscal years was our families who are at risk of homelessness. And those are the ones that are kind of unknown, right, when we do our point in time count. Those are the couch surfing families, the ones that are sharing housing and no longer can afford rent, and they have to be leaving. So that's a huge population that's coming to in now that was not eligible in past years because they technically had a roof over their head, and they, had a place to go. But now the state is also looking at those families who are definitely couch surfing, or they're no longer to afford rent. So we're helping those families find affordable housing while they are in our program. Next slide. So what services do we provide? Obviously, we provide those temporary shelter, motel, hotel vouchers. Those are for 14 days. We do extend as needed. Obviously, we try to do diversion as much as possible, but obviously if they don't have a place to go, we do extend those families. We'd like to look for families also that are in process of leasing up with a landlord, and they just need a little bit more time in order to continue that process. We do first last month's rent, security deposits. So we do double ones to provide an incentive for the landlord. We do full and partial rental assistance. So we do, when the family moves in, we pay for that prorated month, and we do 90% for 3 months, 80% for the following 3 months, and then 70% on. And the reason we do 70% is because we like to connect all of our families to Section 8, and it kind of aligns with that if they are eligible to easily transition into Section 8. The next one is storage unit payments if needed. Sorry, go back to the next slide. Move-in allowances, which helps the family get we give them $150 when they find housing and move in to spend as they need and want. Credit check fees, legal fees, all those things add up as they're searching for housing. We do assist with those. A landlord incentive. So for every landlord that leases one of our customers, we do give $1,000 landlord incentive, and that is per household that they have. So they can have multiple properties, they'll get an $1,000 incentive. And it's just a carrot for the landlords to lease up, because a lot of our families have a lot of different barriers, as you all know, and it helps provide that extra financial security to our landlords when they do lease to some of our customers. We do utility deposits and also making home habitable. We do refrigerators, sometimes stoves if needed to pass inspection, beds for those families out there. So those are a couple items that we do for those. And of course, eviction prevention assistance is a big one that's coming through right now for those families who are facing eviction. We don't want them to become homeless. So we try to keep them and help them retain their housing. Next slide. There you go. So our contracted partnerships, I did mention our amazing partnerships with the County of Riverside Housing Authority. We have a great partnership with them. Like I said, it started with Tanya. Now Gina's over the program, Marasco, and it's just amazing how great our partnership is. We do case conferencing. We meet every week. And I don't know, it's just great. I can't see how great it is, how much more great it is. But we contract with Housing Navigation Services, and obviously they do some billing and permanent housing invoicing for us. But of course, a lot of case management, we have to kind of work together to manage these caseloads because our families are dealing with those higher barriers. Of course, there's our partnership with the Riverside University Department of Behavioral Health as well. We have behavioral health supervisors in our offices that we can connect our customers to, which is a great partnership as well. We all meet weekly and discuss cases as needed. They provide the domestic abuse services, the substance use services, and they deal with the untreated and undertreated behavioral health. Amazing partnerships with both agencies, and yeah, they're the greatest. So next slide. Program referrals. How do you refer the program? Obviously, we do internal referrals once they go through the CalWORKS Temporary Homeless Assistance Program. They get referred over to our program, but you can definitely just email me, phone call me, send a smoke signal. Anything that we can try to get those customers into our program is great. So don't hesitate to email me. We do have a HSP email box as well that we're utilizing. We used to have an 800 number, but it was we didn't have enough staffing to man that. So we do have that HSP email box. It's a public-facing email box that you can also email. It's hsp@rivco.org. It's down at the bottom of the slideshows. But definitely you can email it there. We would just need a CalWORKS case number, the customer's name, phone number, of course, and date of birth if possible, so we can look them up in our system. And I think I have that on the next slide, what information we kind of need so that we can get our customers connected and roped in. But there's my information as well. If you want to email me, I'm always available. And if not, definitely email that email address. So I think that's it. I know I spoke pretty fast. I only had 10 minutes, and I hope I was in with that time. But if anybody has any questions, please feel free to reach out now or later on as time goes on. So thank you for letting me present. It was amazing. I wish I was there. And I can't hear anybody if anybody's talking. Is everybody good?
I'm so sorry, Renee. Please
No,
forgive
you're
me.
good.
I was saying, if does anybody have any questions? It's an amazing service. If you've run into families that are in crisis, she's wonderful. Gina, yes, let's hear it. Did you hear that? It's what is the definition of family, Renee?
A family, so it's mom, dad, or for CalWorks, a lot of them, it's a single parent, but it's mom, dad, children. I recently heard that stepfathers are also in there. So any family unit. So I hope that helps. That makes sense.
That's a good question. Anybody else? Any questions? Definitely save her contact info. That's, like they say, you have like a platinum or a gold contact. That's one of them. Trust me. Let's give her an amazing big hand because they do a great job. Great job.
Thank you, everyone.
Oh, okay. So let's see. Agenda item 5.1. We have, agency and committee chair awards. So we're going to call up Tanya and somebody named Karen.
You think we should do it here?
Here? Yeah, we'll do it here. So, Tanya, I'm going to let you jump in and lead it. So let's hear it.
Absolutely. It's so special to be able to be with you guys here today in person. I think we were talking right before the meeting, trying to figure out when was the last time that we met, and it was definitely pre-COVID. So sometime in probably early January 2020 or December 2019, since we've gathered together in person. Of course, since then, we've continued to meet with you on a virtual basis. And we are so thankful because, COVID did not stop the critical services that each of your agencies provide, from pausing or stopping. We've continued, and just because this is our first time meeting, our first time meeting since then, we really wanted to take the time to recognize people in the room, all of you that have been critical in helping us address homelessness. So we are going to be passing out certificates, and probably right before or during lunch, our hope is that we can take pictures with each of your agencies as we pass out those certificates. So if we can advance to the next slide. We wanted to recognize, I know in very, very small print, all of your agencies for being with us, remaining with us in this fight against homelessness. I love the way, Renee described many times we have each other on speed dial when we have a person in front of us and we need to connect them to shelter. We need to connect them to healthcare services or shelter. And again, we cannot stress enough how critical you are in this work with us. So thank you to all of our agencies who are here in person, but also all of you who are attending virtually. So if we can just give each other a big round of applause.
Yes, for sure. And Tanya, can I say something also? I also just wanted to say to all of you, especially, we're getting to the point where the year is culminating. I can't believe that 2023 is almost over. And I know that each and every day, sometimes you guys may suffer from, who's heard of compassion fatigue? Anybody? This space is not an easy space to work in. It takes people that have hearts that are just so huge, and where you feel it's a calling in life to change other people's lives, because it's not for sissies. This work is hard work, right? Isn't it? It comes with a lot of challenges, but it also comes with so many rewards. And so I just wanted to thank you as your chair from the bottom of my heart for the amazing work that you guys do every day across this county to transform lives over a county that's 7,303 square miles. I think it's quite remarkable. So I hope you guys can pat yourselves on the back and also to all of the staff and teams that you work with here in this room that are represented, and even people that are not participating that we know we need to recognize. Thank you, thank you, thank you on behalf of the thousands of people whose lives you have transformed. So.
You are all amazing, 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 amazing. And so with that, we did want to take time right now to recognize the chairs from our various subcommittees. So we're going to be starting off with the certificates to the chairs from our local emergency food and shelter program. And so if you're here, I know we've been trying to eye the room and capture everybody. Hopefully the individuals are here. If not, again, we will be mailing out these certificates. But for those of you that are not familiar with the Emergency Food and Shelter Program, we know it as EFSP. This program is critical in meeting and providing rental assistance in addition to utility assistance, as well as coordinating shelter services for residents county-wide. And this board is super active. Talk about being nimble. During COVID, we probably called a special meeting every month, sometimes every other week, when we were working with the national board to allocate additional resources that were provided to our county. And so with that, we want to recognize, I don't see Greg Snow, but a lot of you know Greg Snow from CFLC, and he might be here virtually. So Greg, we just wanted to, actually, I'm sorry, guys. I think I got it mixed up. It's actually Gina Morosco. Greg will get an award, but it's a different award. So Gina Morosco, I don't know if you're here virtually, but thank you for all your work with the Emergency Food and Shelter Program. And then our Vice Chair, Linda Salas, who is also with the Department of Public Social Services. And now we'll move on to the Youth Action Board Council. So the Youth Action Board is a group that meets regularly to coordinate efforts to address youth homelessness. During our last meeting, you guys heard that we received an award of $7.4 million from HUD, one of 16 communities across the entire nation, to support this effort. And we cannot say enough about this board. Greg Snow with CFLC, I don't see him here, but he might be here virtually. So we just want to acknowledge you, celebrate you. Thank you for all the work that you do. In addition to Nikki DeLong, who is with Olive Crest. Many of you know Olive Crest. They provide a safe space for families with children who oftentimes are connected with our Children's Services Division. Again, I don't see Nikki here, but she is always usually with us virtually. So Nikki, thank you so much for the work that you do and that you've been doing to address this important issue.
Out, Amy.
Next, we wanted to recognize our Homeless Management Information System and Coordinated Entry System Advisory Committee. About 3 years ago, we made the decision to combine the two subcommittees because both systems are organized within our Homeless Management Information System. And Leonard Jarman, who is here today, has served in this role for, Leonard, how many years?
It's been some years, yeah. I've actually been on the committee, I think, since 2007.
Since the very, very beginning. And I just wanted to share that in 2020 during COVID, we made the transition from client track, so a different HMIS server into Clarity. I see some nods. And I just wanted to share how invaluable Leonard was in that process, helping us through the RFP, helping us select the new vendor, and making sure that all the client records got transferred over, but also helping us create a workflow now in HMIS that is much easier for users to access. So thank you, Leonard. And then his vice chair, Erica Gonzalez. I don't know that she's here today. She might be with us virtually. But again, just wanted to celebrate her because I know that she's been key in working alongside him as well. And we definitely wanted to take time to also acknowledge the members from our Continuum of Care Board of Governance. The Board of Governance is the entity that meets and reviews any policy recommendations that come from each of you, this membership body, and also formalize and finalize funding recommendations that support new projects. I just want to stress again, the Board of Governance is also another body that has been super nimble through the last 2 years, jumping in to meet to ensure that, right, there's no delay in starting up new programs or reallocating new money to new programs to ensure that we can continue to serve individuals. So I know that not all of our board members are here, but we wanted to take the time to acknowledge those that are. So with that said, we'll start off with Mr. Greg Rodriguez. And again, we hope that you'll hang around because we want to take some great pictures with you now that we have our photographer. So Greg, you can't go anywhere. And then Councilwoman Edwards, who I know a lot of you tune into the Board of Governance meetings, but I can tell you, and I've shared this with Councilwoman Edwards, I feel comfortable sharing it here, is, right, she's the one council member that will ask a lot of questions, usually data questions. So when we're preparing for board meetings, the motto internally in our office is usually, well, what is Councilwoman Edwards going to ask? So. And I know that our Board of Governance chair and vice chair couldn't be here today, but I do see one of his team members in the room. So Dr. Lur, right? We talked about that earlier. It's Dr. VRL, but I asked her earlier if she had a nickname and she said Lur. So I'm going to tease her about that. We are so honored to have the Director of Behavioral Health serve as the chair for the Board of Governance. So Dr. Matthew Chang, we celebrate you today. And Larissa, I want to thank you for representing. And so this acknowledgement is very special. I'm going to have our director, Heidi Marshall, come up. In addition to Emma and Stephanie, if you guys want to join me up here. They're all special.
Before we get to this couple of very important acknowledgements, I just want to take a moment to acknowledge this young lady here.
Yes.
I have to. If you can just indulge me, I promise you I won't go more than a minute or two. I first met Tanya when I tried to become part of the court-appointed special advocates, or CASA. And from that first 2 minutes of meeting her, it was clear to me that she cared about people, young people, older people, all kinds of people. She doesn't just consider this a job. It is her passion. She does not, there is not a minute in her day, even when she's not at work, that she's not for humanity, for all humanity. We know life is hard enough as it is, and for our most vulnerable populations, it's even harder. And she lives, breathes this work, and we're so grateful for her leadership and really for caring as much as you do. I also will share with you, because my 2 minutes are up, that she only hires and recruits for her team people who truly care. And we don't have anybody who doesn't. So that's just a blessing for all of us. And looking around the room, I can see that somehow she manifested into this entire group coming into and being part of this group. Because as I look around the room, I don't see anybody who doesn't really care about the work that we do. So I'm very grateful for her, and I know that you all feel the same way.
It's an honor and it's a blessing to do this work and to do it alongside each of you. Seriously, we are a team. We're making change, and a little later today, we're going to be talking about our impact. So next, we wanted to recognize really a powerful duo that serves in two subcommittees. So Karen Roper and Michelle Davis serve on our policy and advocacy committee in addition to serving as our chairs for this meeting, our Continuum of Care meeting. And powerful duo is probably not enough for the amount of work that they do, advocacy that they do to help us plan, coordinate, but also advocate, right, on a federal, state, and local level for resources to expand our program. So we wanted to take time today to celebrate them, the special people that they are, and the impact that they have had in really shaping the work that we do. So Karen, Michelle, thank you so, so much. And with that, we'll give you a round of applause, and we have some flowers for you. If you can come up, we'd love to take our picture with you now.
Okay.
We meet with them in addition to monthly for these meetings, every month for a pre-planning meeting. So it's a lot.
Just a nice tattoo. All right, 1, 2.
All day on my head. When you get old, you can't see anymore. All right, thank you.
You pulled a fast one because I really wanted this to be about you guys today.
So remember, we want to stay after and take pictures with all of you. So we'll take a break between so you guys can touch up and do what you need to do. Just kidding. Thank you. And with that, Chair, I'll hand it back to you.
Can you guys hear me online?
Yeah.
Yes? Okay, it seems to be working. Yay, thank you. Who was the yes? Okay, let's see. Now we are going to go to agenda item 5.2, proposed 2024 meeting calendar, and we're going to hand it over to Mar. Okay, Mar, take it away.
Hi, everyone. Can everyone hear me? Awesome, thank you. So as you can see on your screen right now, these are the proposed dates for next year's COC meetings. And for the most part, all of these meetings fall on the second to last Wednesday of the month, except for April, June, and September. These were shared at the last meeting as well, and today we are moving to approve it. So I'll pass it back to you, Madam Chair.
Okay, we got another bingo. Ah,
Oh.
nice. Okay, so do I have a motion to approve the 2024 calendar? Who can believe it? 2024. Okay, our Vice Chair, Michelle Davis, made the motion. Do I have a second? Come on, don't be shy, members.
I
need a
second.
second.
This is Michelle from Aspiranet.
Okay, thank you. Do I have any abstentions or objections? Hearing none, we are ready for 2024. Woohoo! Okay. So let's go ahead and go to the next agenda item, 5.3. This is the Room and Board Coalition. I'm super excited to hear about this. We have Dr. Larissa Villarreal from RUHS Behavioral Health. Larissa, take it away.
Hi, good afternoon, everyone. Can you hear me okay? Okay, hopefully everyone online can hear me as well. I'm Dr. Larissa Villarreal. I am the new administrator for Hope. I'm so happy to be here with you all in person today. It's an honor, and I'd like to thank Karen Roper for hosting us and the city of Corona. Today, I will be chatting with you about a possible room and board coalition or what that might look like for the county of Riverside. Next slide, please. So these are a couple of the items that I will be touching on today. The conversation that behavioral health was challenged to initiate today in this form, a larger audience, which is the continuum of care. Opportunities for the continuum of care for providers of room and boards, and also for our consumers. I'd also like to chat with you about what the County of San Bernardino is doing, next steps, and we'll open it up for questions, but I will premise by saying, be gentle, because I just dove into this a couple of weeks ago. So next slide, thank you. All right, so jumping into the challenge. Miss Brenda Scott, who I think is joining us virtually today, is the Behavioral Health Commission Housing Committee Chair, and she's also the Executive Director for NAMI, the San Jacinto chapter. She encouraged behavioral health to explore what this might look like for the County of Riverside. So super excited about that and hearing from all of you later today about what your thoughts are. So as you know, across the United States, in California and the County of Riverside, we're really feeling a squeeze, right? And what does that look like for us? That looks like not enough emergency shelter beds, not enough affordable housing opportunities. And we've heard from University of San Francisco, Harvard, Stanford, they come out with reports talking about it's going to take 3 to 7 million units, affordable units, for us to meet the need of folks that are at or below the poverty line. It talks about migration from different states throughout the United States, as well as people up north migrating to the IE. So what does that look like for us? It looks like a squeeze, right? So here at the Continuum of Care, this is a safe place for us. We all work tirelessly, as Tanya noted earlier, to serve our target population, right? And we're all caring, compassionate people that really are moving the needle forward. And I'm so appreciative of all of you and proud of the work that you do. There's opportunity, right? So I want to go ahead and talk about the room and board versus board and care in just a second. But before we jump into that, I want to talk about the collaboration that we have here. This is a space for us to get innovative, to share ideas, to bounce them back and forth as a sounding board to folks, and to maybe get pulled back and grounded in certain areas. Like, you know what, Larissa, that's an awful idea. What were you thinking? But it's a safe space here. And I'm hearing that from the experts. So we could have at it later in Q&A. We can take an opportunity to explore what a room and board coalition ought to look like. But before we do, what's the difference between the room and board and a board and care? So the room and board, for folks that are unfamiliar, is a supportive living environment for folks that are independent, that have their ADLs. It's a housing situation that's shared, oftentimes including a meal, utilities, and a bed, right? And this is privately operated, unlicensed. Now, the board and care is also a residential living environment. However, this is for folks that are disabled, physically, mentally, developmentally. And this must be licensed through California Department of Social Services Community Care Licensing Division. Next slide. So, opportunity. As we know, by our last point in time count, homelessness is on the rise, right? So there's an opportunity to expand housing options for consumers. But what does that look like? So the objectives: to increase access to temporary housing, to provide support services for sustainable living environments, to create a live room and board referral list. And some of the key components: collaboration with local government agencies, that's you, engagement with private sector partners, and utilization of existing resources. Again, that's you. So since there's no official oversight of room and boards currently, we're seeing a wide array of living conditions. There's some reports where housing environments are really in dire need of support. And then we have the other end of the spectrum where people are thriving in these environments. Disability Rights California encourages advisory groups to ensure a safe living environment, to make sure that there are processes in place for things like grievances. And also, it's an opportunity for unannounced on-site visits. And this is to ensure that we're protecting our consumers. We're ensuring that they're educated so that they can make informed decisions. And there's also an opportunity for providers, right? This is an awesome way for them to market to our network. And it's also an opportunity for us to advocate for them at the local level. Next. So what is San Bernardino doing? I had an opportunity to meet with Dr. Renee Karras last month. She is from San Bernardino County, and she shared with me that the Room and Board Coalition started in 2010, and it is peer-led. She also shared that operators come together to share their expertise in a safe space, and they're able to create policy and procedure that help to maintain quality and standards, and also ensure safety for folks that are utilizing room and boards. So the coalition, it provides information for provider lists and referrals for housing opportunities. Next. So next steps. This was really an opportunity to start this discussion and identify operators. Do we have any operators that are here today, maybe joining virtually here in the room? Okay, well, we need to identify them. Who are they? We need to ensure that we're asking the right questions. So that includes, is there operators who are interested in coming together to run a run and board coalition or advisory group? How many people would that be? What does that look like? What stakeholders should be part of the conversation or have a seat at the table? So oh, you could go back, sorry. So we at Hope, we have a monthly meeting the second Tuesday of every month, and Miss Brenda Scott leads us in that meeting. She's the chair. And we are willing to open up our meeting as a forum to start this discussion. So if you or anyone that you know might be interested in joining us in January, we're dark in December, please make sure to reach out so that we can get you the link to join virtually or so that you could come and join us in person. I did add Sober Living Network here because they do have a great model that we could learn from and lean into when we're creating this opportunity, if we decide to create this opportunity. And certainly it would be more of a support system rather than leading the charge. Next. Okay, so this is the part where I'm asking for you to be gentle. I'm going to open it up for questions if anyone has any, online or in person. Yes, ma'am. So she asked about getting together in January. And so that is the Behavioral Health Commission Housing Committee meeting. It takes place every month, the second Tuesday. And that's where Hope comes together with our chair, Brenda Scott, who encouraged this conversation to start. So if anyone's interested in joining us, we invite you to attend. Great.
Thank you. Hi. There's also a couple of points I want to point out. I was at the Older Adults Integrated System of Care meeting yesterday, and it came up about the fact that seniors desperately need housing they can afford. And of course, it's going to take a while to build. But I think we need to focus on doing that because the population of seniors is skyrocketing. The baby boomers are booming and then some. Also, in my case, I live in a 55 plus community, but my park will not allow me to rent out my extra bedroom. So I'd like to make sure that we address, because while it's in my mind, to try and get through to those kinds of communities, to try and get them to open up and allow us and, explain that, these people are going to be on the streets if we don't rent them a room. So that's what I want to do.
I appreciate that. Thank you for acknowledging that special population and the importance of making sure that there is housing and beds available. So I invite you to bring that comment to the meeting in January.
Question. First of all, thank you so much, Larissa. I think this is awesome. Every time we can think about something new and creative. I just was wondering if you could reflect on the San Bernardino model. When you think about because it seems like the non-licensed one is almost like an element of shared housing in some respects, right? And shared housing is almost like dating or matchmaking, right? And it takes case management to manage that because I smoke, you have pets, there's like these different nuances besides just the rent and that type of stuff. So I'm wondering how that is being addressed and if they're developing like some kind of a regional where they're doing an assessment of property owners that are interested, people that might want to rent a room, and then the case management component. So.
Great question, Karen. Thank you for that. So I will say that Dr. Renee Karras is getting me in contact with the chair for the advisory board, and I haven't had an opportunity yet to meet with them. Their meeting a couple of weeks ago was canceled, and so I'll have to wait until the next one, but definitely a great question to pose to the group. And you're right, there's different personalities that may not work out, but there are trainings for folks so that they can understand how to match individuals so that they can be successful in a shared living environment.
A great way to add more inventory to our resources. So I'm excited. Whatever I can do to support you, I'm excited.
Thank you. Greg?
You need a mic here. Pass it on down, Eric.
Yeah, first of all, I apologize the allergy voice here. I think this is really exciting, Larissa, to address the point that was made too. I think I would imagine that this advisory group would look at what kind of policy changes, such as not allowing people to rent within these type of parks, would address. But I also want to emphasize what we're trying to do within our department is really inventory our housing stock. Of all types of housing. So it'd be interesting to know if San Bernardino does that. If not, it would be interesting for us to do that and how we would like to work with this advisory group to actually start tracking those type of bed, both room and board as well as boarding care as well.
Love that. Thank you, Greg.
Yeah, can you imagine if in real time your street outreach teams, your housing case managers had access to a list of where these units were located and could just, hey, I need somewhere to take my person today and plug them in that day. That would be great.
Thank you, Tanya. Anyone else? Okay, I appreciate all of you. Happy holidays and thank you for having me.
Tanya, maybe what we can do is have a follow-up to send something out to survey the continuum of care about those that might be interested so that we could support Larissa and make sure that what we're doing is complementing what Greg was talking about so that they're parallel tracks, not counterproductive. Does that sound good? Okay, perfect. All right. So let's see, standing items. Okay, agenda item 6.1, YHDP update. Where is the illustrious Monique Guerra?
Okay.
Hello,
hello.
Did we hear another bingo? Ah.
Mary, I told you we were gonna win. So we're splitting that prize. Got it. Do I do it now? Make sure you got it. Got it. But they're doing bingo work. If you need to grab one. Can everyone online see me? Oh.
Family.
Hi, Renee. I'm glad that they gave you a shout out. I know that you are working on a youth case as we speak. So thank you so much, Renee. And then is that Beth? Beth, we have to meet. Got a lot of educational items. All right, ready? Hi, everyone. My name is Monique Guerra. I'm the Homeless Youth Coordinator for Riverside County Continuum of Care. And and then I know you all are hyping me up as well. Thank you all. Thank you. Feel very loved. As you all know, we got YHTP. Whoop, whoop. Right? The momentum that we needed to keep going for youth homelessness and ending, right, youth homelessness for all the youth across our county. Quick update for YHDP, and if you all have attended our community meetings, thank you so much for attending, and if you haven't, that's what I'm gonna tell you about. So as you know, we were awarded the YHDP, the Youth Homelessness Demonstration Program grant for $7.4 million for youth homelessness, so huge accomplishment for our county. Again, if you've been attending our community planning meetings, they are on Wednesdays. And if you want to get more involved, please let me know. We definitely need all of the experts in the room. Most importantly, we need our youth partners. So again, if you have youth in your current programming or in your shelters, please connect them, right? They have a voice no matter where they're at in their journey. And we want to make sure that we bring their voice and integrate it into this planning process. And so we're going to be having community meetings every Wednesday alongside our HUD TA providers. So they are there to guide us in our CCP process, which is our community coordinated plan. And those meetings are on Wednesdays. But again, I know you all are very busy. If you do have time to attend a monthly meeting, our youth advisory committee meeting is once a month, just like our COC meetings. It is tomorrow, and we do bring updates about YHDP and the CCP to make sure that everyone has the information, no matter what meeting you're going to. If you're attending the COCs, we'll continue to give YHDP updates to make sure everyone has the information and knows what's going on and where we're at in that process. So if you're interested in that, please let me know. Email myself or Mar, and we'll get you connected to those meetings as well. What's another item? Ooh, really exciting. Our HUD TA providers are going to come out to do an on-site training with us and work through our CCP. So I really hope that you all can make time on that day in your calendars to attend in person. And again, you'll be working alongside all of the other providers, our youth providers, and especially our youth partners to really work on this CCP. So please, if you can, make time on your calendars for that. And we will also be having within the next few months, and you'll receive an email, an authentic youth collaboration training also put on by our HUD TA providers. That one's huge, right? We can say we know what authentic youth collaboration is, right? But we need to really understand and look at what authentic youth collaboration means, look like, and feels to our youth partners. So starting off with just calling them, right, our youth partners. So please, if you have time, attend that training. And again, we will send more information via email. And I am always here to answer any questions and support along the way. And thank you all so much for everything you all have done from the beginning of this process to applying for YHDP, receiving it, being there, and then now working on this coordinated community plan. So thank you all so much. Are there any questions? Ooh, good question, Gina. The community meetings are on Wednesdays from 10 to 11 a.m. They're virtual. Yes. So we'll make sure to send out an email reminder. And so if you're interested, let me know and we'll add you to those meetings. Any other quick questions? All right, let's go team YHDP.
Good job. Okay, next agenda item 6.2, coordinated entry lead update. And I think, is it going to be Monique or is it John that is presenting? John, okay. And is he presenting remotely?
He is presenting.
Hey, John, how's it going?
I'm not sure if he's on yet. He was having trouble accessing the link. If you want, we can move.
Okay, no problem.
Thank you.
All right, so let's see. Just some quick items. So informational items, you see the various committees and the status of their meetings. Michelle and I always get excited about signing letters of support because it means hopefully more resources into the region. So that's another time that we get we do cartwheels every time we get to sign one of those. Yes. Okay, we tapped out. So we were excited to sign the Walton Family Services letter of support for ESG HP and then also his daughter's house for the same funding source. So we can wish them the best of luck as they go through that process. Also, for purposes of transparency and accountability, the team always posts the annual performance reports so you can see LSSC Riverside PSH project is in there for your reviewing. So at this time, whether you're virtual or whether you are here, do we have any calls for agenda items for the next meeting? Because it's the last meeting of the year. I cannot believe it. Anything you guys feel like we need to be covering? Any burning ideas, requests? Are you guys happy with the items we've been covering? Are we helping you? Do you feel supported? Do you feel loved? Okay, good. Yes, let's hear it, Gina.
Low barrier shelter models for people who use drugs. Now, as far as I know, we really don't have anything addressing that. And from my working on the street, the biggest complaint I get from the homeless is, well, they make you stay, whatever. This particular program is, okay. This particular program is a flexible program. And actually, I shouldn't say a program. There were 3 different programs. Unfortunately, I missed one of them because I had to go to my other meeting. Oh, that was yesterday. So anyway, point being is I think we need to approach some of our new projects allowing the people that are on drugs at least to cross the threshold and get some help and get the help of health or if they want the mental health, so we've been making it mandatory, but I think we need to open it up after hearing about the success in Florida and in Pennsylvania. Those are the 2 I heard about.
That's great. So a couple of things. She said a key phrase about SAMHSA funding. It has unique programs. And I have a feeling because a lot of the SAMHSA money goes direct to county behavioral health programs. So we might want to tap into seeing what they're doing with that. And then I know just in working with the team that there are a lot of low barrier shelters across the region. region. You're looking at two cities right here, Corona, Norco, that can tell you they're so low. You could, that like limbo. How low can you go, right? As far as meeting, and this is Leonard's statement that I coined from him. I steal it. You meet people where they are, you don't leave them where they are. And so there's a lot of low barrier programs across the region. It sounds like we might need to do a better job letting you all know what the different criterias are for low barrier, but then also look about opportunities for SAMHSA. Does that sound good, Gina?
That does, and just to let everyone know that they posted the whole webinar available for them, for you to look, and I don't remember the exact thing, but it's hhrctraining.org.
If you send it to us, okay, Emma is saying they have it, and we can distribute it to the continuum of care. Perfect.
Okay.
Thank you. That's what we want to hear. Thank you for speaking up, Gina. Anybody else with ideas or suggestions? Don't be shy. Come on. Let's hear it. Okay. Hearing none. Anybody have any announcements, whether you are here in the room or virtual? Come on, there's lots of stuff happening. I know you all are busy with the holidays. I'm sure there's a gazillion. Oh, okay.
John.
So after the announcements, then we'll punt it to John, but let's go ahead. Who has an announcement?
I have an announcement.
Okay.
I just want to recognize Walden and the city of Riverside got a 4.3 home key round 3. So we're going to, Walden's going to be acquiring some single family properties to do transitional housing for up to 25 beds. So kudos to them. And we're looking, hopefully the state will release another round 4 so we can start pursuing some PSH and, hotel conversions. And then I also want to thank John Horn. He did attend our case conferencing meeting that we have with our youth providers every Monday. The city of Riverside has an initiative to end homelessness among our youth population, which our mayor had put forth. And so the teams get together. It's not only Riverside. We do have some other adjacent cities and county providers that do join us as well. And they did let us know at Monday that there are 71 youth in the Riverside County Community Queue for TAY, 61 in the city of Riverside. 29 referrals have been made in the city of Riverside, and then of the countywide, 42 have been connected to housing opportunities and are awaiting outcomes. So it's great to hear the data and the outcomes and the great work that the team's doing. And soon we're going to get to functioning 0, and I know we'll get there. So thank you guys for all your hard work on that.
That's awesome. Come on, you guys. There's more out there. Who is that? Emma? Let's hear it.
Thank you so much. We are going to be sending out an announcement. What is today, Wednesday? Tomorrow, about our longest night event. It's going to be at Fairmont Park, and I wanted to just briefly say thank you to Michelle and the City of Riverside, Councilmember Edwards, for sponsoring the event location. This event is being hosted in collaboration with them, as well as behavioral health, and we will be hosting a resource fair. We'll also have a dinner available for our homeless guests that attend the event. The Department of Veteran Services will also be there, and we are going to have a very special veteran recognition for those individuals who are on our deceased list that served our country. So we'll be having a special recognition for them. It'll be a really great night, and we're hoping that we have a good turnout. So if you are interested in participating in the resource fair, please reach out to the COC, coc@rivco.org. We don't have a ton of space available, but we do have a little bit of availability for a couple organizations. Our outreach teams are going to be there. Also, we are hoping to have some shelter beds, and I'm looking at Leonard, available for the night. So if we have folks that are willing to go into shelter, our outreach teams will be available to transport them day of. So it's going to be a really great event. I hope everyone can attend.
Nice.
So I'm sorry, December 21st, the longest night of the year.
And hopefully, as we continue with all of the efforts, each time we have the longest night, we're going to see less deaths on the street because our system is getting stronger and stronger. Because that's what, right? We're remembering people that have passed on the streets. So I look forward to the day when we don't have to have a longest night, right? That'll be our goal. Okay, who else has announcements?
This
Rashana,
is-
let's hear it.
Good afternoon, everyone. I just wanted to give an update to the Continuum of Care regarding our landlord initiative that we are launching. We're hoping to launch it in February of 2024. We landed on a name and it is Hope to Home. So we have been working slowly. We've been slowly working with our TA providers to get this launched. We're working on our landlord initiatives and all of the policies and procedures because it also comes with some mitigation funds for the landlords who sign up through our PAD Mission. It's our PAD Mission platform, but we're calling it Hope to Home Initiative. So thank you to all of the providers that responded to our survey that we put out there because we wanted to build the program based on your needs. So thank you to the providers that responded to the survey that we put out a couple of months ago. I just want to let you know we haven't forgotten. We're working on the launch of it February of 2024. Thank you, everyone.
Okay. All right. In the interest of time, because it's already 4:30 and we still have other stuff planned, I'm going to move to John, who has a quick update for us on coordinated entry.
Yes, very sorry, everybody. I've been trying to connect for the past hour. For some reason, it just put me in a lobby and I wasn't able to get in. So I'm very sorry about that. But I am ready to go. And I'll get through this really quick. Next slide, please. There we go. All right. So with housing placements in the month of October, we had 44 people housed. Other exits was 4. As far as assessments entered into clarity, we had 182 total, 41 total for the month of October. Next, we will go over we'll go over active and need of home connection. Currently, we have 1,020 people on the queue awaiting for home connections, and that does correlate with the city by city data report that we did come up with. Next, I will go over the Home Connect call center breakdown. So for the month of October, we had at Home Connect, we had 1,749 calls. Literally homeless, it was about 7% of the people that were calling Home Connect were literally homeless. At risk of homelessness, it was 16, or almost 16.5% of the people that called Home Connect were at risk of homelessness. And then people that were out of county were about 60% of the people that were calling Home Connect were out of county. Next slide, please. So now we're going to go over areas of improvement. First off, one of the areas of improvement that we did wind up finding out in the month of October was agencies not removing clients from the community queue. What CES is going to start doing is we're going to start scheduling training agencies and agency members to remove clients from the queue, along with returning the home connection referral once a client has been housed to accurately report the data that we all need. Next, new agencies need training and clarity. We do identify that, and CES is going to start to schedule in-person and virtual meetings for new agencies and new members so we can be able to train them properly and clarity and everything they need to know about the process to be able to connect these clients with housing opportunities. Lastly, we are looking to streamline the process for PBV projects. We are currently working alongside the Housing Authority to streamline the referral process by sending out the Housing Authority applications along with the project applications to the managers and housing navigators, of course, and alongside with Housing Authority. So we will be able to help speed up the whole application process. Next slide, please. Lastly, a few project updates for Oasis Senior Villas. It was scheduled to open in early October. Now we're around mid-November. I will get another update tomorrow. I know it was pushed back again last week. So currently we are at mid-November with no current actual date of TCO. Next, we're going to go to Vista de la area, which is also experiencing some delays. We were previously scheduled to open October, early November. It did get pushed back to December. As far as the last meeting we had last week, it has been pushed back again to January of 2024. The next project we're having open is going to be Ranchos Los Bolsas, which is in Temecula, and it is currently on track to open in February of 2024. We do have two new projects that are going to be opening, which is Vista Sunrise, and they are set to open in February of 2024 also. And then we have Aspire, which is also set to open in March of 2024. And from CES, we'd like to thank all the agencies that have helped gather all the documentation needed to be able to connect these clients with opportunities. We really appreciate you guys. You guys are doing such a great job, especially, I know you're probably tired of seeing my emails, but thank you so much for being receptive and very responsive to everything. Lastly, for CES partnership meeting, of course, we are always looking for people to present. So if you have anybody or have any resources that you would like to have presented in the CES partnership meeting, please feel free to email me or homeconnect@ruhealth.org, and we'll be able to schedule a date for you to present. Thank you guys so much. That's all I have.
All right. Thank you, John. Okay. So did you have another announcement? Okay, Ayako? So John, the question is, and we can get it out through the continuum of care, or you can answer real quick, but the cities of the PSH projects?
So Vista Sunrise is going to be, I know Oasis is in Riverside. Vista de la Sierra is also in the city of Riverside. Rancho Los Bolsas is going to be in Temecula. Vista Sunrise is going to be in the city of Riverside, but they're not looking just for the people in the city of Riverside. Aspire is also for what I'll say is Riverside County, same thing in the city of Riverside, but they are open to anybody throughout the county.
Give it up for the city of Riverside. Man, she's got to like raise the roof.
Council members in your city that they're advocating for more shelter beds, more housing.
Yes. Yes.
We had recently the mayor come out from City of Moreno Valley. They want to collaborate as well. And I know they'll be reaching out to the county, and we kind of shared best practices with Path of Life on their shelter as well, and kind of what they can do in their own city. So we look forward to kind of sharing those best practices with other cities.
Yeah, so that's one of the formulas to success is elected official champions that really understand the issues. They can really help to move the needle. We experienced that here in this fine city as well. So, okay, so what we want to do, because we do have our photographers here from the county and the city of Corona, we want to make sure that we can get all of your beautiful faces in one picture. So, and Tanya, did you have other certificates to pass out to agencies? Okay. And then you can pass them out after. Yeah, that's okay, everybody. Okay, photographers, what is your opinion about where we should stand to try to get everybody? Should we go up there? Well, we can move the screen. We can actually, so I guess what we can do, everybody online, we're going to say we love you. Thank you for joining us. We're going to go ahead and officially end the meeting and begin the festivities. Sorry you can't be here with us. So we're going to log out and pull up the screen, Mar, and then we'll get everyone up front, okay? So huh? Oh, you mean just at the whole, everybody sitting in their chairs?